Having reviewed the most current data, it is now our clinical judgment that the time to lay out a plan for COVID-19 boosters is now. Recent data makes clear that protection against mild and moderate disease has decreased over time. This is likely due to both waning immunity and the strength of the widespread Delta variant. Even though this new data affirms that vaccine protection remains high against the worst outcomes of COVID, we are concerned that this pattern of decline we are seeing will continue in the months ahead, which could lead to reduced protection against severe disease, hospitalization, and death. That is why today, we are announcing our plan to stay ahead of this virus by being prepared to offer COVID-19 booster shots to fully vaccinated adults 18 years and older. They would be eligible for their booster shot 8 months after receiving their second dose of the Pfizer or Moderna mRNA vaccines. We plan to start this program the week of September 20th, 2021. I want to be very clear. This plan is pending the FDA conducting an independent evaluation of the safety and effectiveness of a third dose of the Pfizer and Moderna mRNA vaccines, and the CDC's Advisory Committee on Immunization Practices issuing booster dose recommendations based on a thorough review of the evidence.
We believe clearly that the data today does not indicate that boosters are needed. And we need to know which groups, at what period after the vaccination, and which particular vaccines people have received in their primary course.
The analysis is extremely complicated because obviously we have not many studies, we have different vaccine, we have the emergence of variants, and we have different population groups. But what is clear is that we do not have sufficient information, and the data are not suggestive that at that point in time, we need booster vaccinations.
I think, though, regardless of what ultimately the science comes to an agreement regarding the length of protection or the increased benefit from marginal increase in benefits from having booster doses, the reality is right now today, if we think about this in terms of an analogy, we're planning to hand out extra life jackets to people who already have life jackets, while we're leaving other people to drown without a single life jacket. That's the reality.
To overcome these fragile times, we must do better at sharing resources and health tools. Our mutual resilience is only as strong as our weakest bond. Vaccine injustice is a shame on all humanity. And if we don't tackle it together, we will prolong the acute stage of this pandemic for years, when it could be over in a matter of months.